Almost a year ago, Dr. Hazen said that within a year there was going to be a very positive development in correcting astigmatism. And he said it would eventually be done at the same time or very close to removing the cataracts. So I decided that my vision needed some correcting, so he did both of them. It was mostly long distance, and things were beginning to blur. And my wife had cataracts removed, and she suspected maybe that was part of the problem. So I went to see him, and he said yes. And he wanted to know if I wanted to take care of the astigmatism at the same time. I said, sure. I was confident after I did some research that this was the way to go, then that Dr. Hazen was the one to do it.
When you have cataracts, we do some basic measurements to see if you have astigmatism, as well as all the other measurements we do for cataracts. And then when we talk about what type of lens you're going to choose, we give you the different options. Either a standard lens where it would clear up your vision, but you would still need to wear the glasses because of the astigmatism. Or the other option would be to do this lens that corrects for astigmatism called the toric lens, where it does cost additional money outside of what insurance pays, but it would allow you to see in the distance without glasses. Cataract surgery procedure with this lens is exactly the same as any other lens. It takes 6 or 7 minutes to do the surgery. No sedation is required, although it's available if you want that to happen. You just come in. It's a very minimal surgery. You go home and take eye drops, no patch or shield the way that I do it. And usually within a day or two, you're seeing well. I get a really positive feedback from the patients we do. They just can't believe that the surgery was that easy. The surgery center now, just everybody's so nice and so friendly, and it's just so much nicer than having to go to the hospital for these kind of things. Yeah, probably the biggest thing I hear from them when I'm done with the surgery is, that's it? That's all there is to it? And I say, yes, that's it. It only takes 5 or 6 minutes, and that's it.
I can take these glasses off, and the distance vision is good. He said it was almost 20/20. But it was for reading purposes that I needed a new lens. I'm willing to recommend the clinic and Dr. Hazen in particular to anyone who asks me my experience. My expectations were exceeded, and I've been very satisfied with them. My wife was a big help. She administered the drops. Otherwise, my aim might not have been as good as it should have.